Tinea corporis is a common skin infection caused by various types of fungi. Despite its name, it has nothing to do with worms. The term ringworm is used because the infection often forms circular or ring-shaped patches on the skin. Tinea corporis can affect different body parts, including the arms, legs, trunk, and face. In this video, we will explore Tinea corporis overview, causes, symptoms, diagnosis, treatment, home remedies, and frequently asked questions. By the way, welcome to our channel. Don't forget to thumb up and subscribe. Causes of Tinea corporis. Fungal infection. The primary cause of Tinea corporis is a group of fungi called dermatophytes. These fungi thrive in warm and moist environments, such as locker rooms, swimming pools, and shared towels. When the skin comes into contact with these fungi, it can lead to an infection. Direct contact. Tinea corporis is highly contagious and can spread through direct contact with an infected person or animal. Sharing personal items like clothing, towels, or combs can transfer the fungi from one person to another. Additionally, contact with contaminated surfaces can also lead to infection. Weakened immune system. Individuals with weakened immune systems, such as those with HIV, AIDS, or undergoing chemotherapy, are more susceptible to fungal infections like Tinea corporis. The immune system plays a crucial role in fighting off infections, and when it's compromised, the risk of developing Tinea corporis increases. In Uyghur medicine, the causes of Tinea corporis are attributed to an imbalance in the body's nature and blood, allowing external pathogenic factors like dampness, heat to invade the skin's nature. These pathogenic factors disrupt the body's natural harmony and contribute to the development of tinea. Treatment aims to address these imbalances and clear the pathogenic factors through herbal remedies, dietary adjustments, and external applications. Signs and symptoms of Tinea corporis. Red, circular patches. One of the hallmark symptoms of Tinea corporis is the appearance of red, circular patches on the skin. These patches often have raised edges and may be scaly or flaky in texture. The center of the patch may appear clear or have a more normal skin tone. Itching and discomfort. The affected areas of the skin can become itchy and uncomfortable. The itching can range from mild to severe, and scratching the area can further aggravate the condition and lead to secondary infections. Scaling or flaking skin. Tinea corporis can cause the skin to become dry, scaly, or flaky. The affected area may also show signs of peeling or cracking. This can result in a rough and uneven skin texture. Diagnosis of Tinea corporis. To diagnose Tinea corporis, a healthcare professional will typically perform a visual examination of the affected area. They may also collect a skin scraping to examine under a microscope or send it to a laboratory for further analysis. In some cases, additional tests, such as a fungal culture, may be necessary for an accurate diagnosis. Treatment options of Tinea corporis. Treatment for Tinea corporis usually involves a combination of antifungal medications and proper hygiene practices. The following treatment options may be recommended. Topical antifungal creams or ointments can effectively treat mild cases of Tinea corporis. Oral antifungal medications may be prescribed for severe or widespread Tinea corporis infections. Antifungal powders or sprays can help manage Tinea corporis and prevent its recurrence. Following proper hygiene practices, such as regular hand washing, is important for managing Tinea corporis. Applying over-the-counter hydrocortisone creams can help relieve itching associated with Tinea corporis. Using medicated shampoos can effectively treat Tinea corporis of the scalp, Tinea capitis. In severe or persistent cases, consulting a healthcare professional for further evaluation and treatment is recommended. Please note that it's important to consult a healthcare professional for a proper diagnosis and appropriate treatment plan for Tinea corporis. Natural home remedies for Tinea corporis. In addition to medical treatments, certain home remedies and prevention tips can complement the management of Tinea corporis. These include: maintain good personal hygiene by regularly washing and drying your body, especially in areas prone to sweating. Avoid sharing personal items like towels, clothing, and combs with others. Wear loose-fitting, breathable clothing that allows air circulation. Keep your living spaces clean and dry, especially in shared areas like locker rooms and bathrooms. If you have pets, ensure they are regularly checked for fungal infections and receive appropriate treatment if needed. Avoid walking barefoot in public areas, especially around swimming pools, saunas, and gym showers. Wash and disinfect your hands thoroughly after touching pets, soil, or any potentially contaminated surfaces. Boost your immune system through a balanced diet, regular exercise, and sufficient sleep. Keep the affected area clean by washing it with mild soap and warm water, then patting it dry. Avoid scratching the affected area to prevent further irritation and the risk of secondary infections. Apply a cool compress or ice pack wrapped in a clean cloth to reduce itching and inflammation. Tea tree oil, known for its antifungal properties, can be applied topically to the affected area after diluting it with a carrier oil. Garlic has natural antifungal properties. Crush a few garlic cloves, mix with olive oil, and apply the paste to the affected area. It is important to consult a healthcare professional for an accurate diagnosis, and to determine the most appropriate treatment plan for Tinea corporis. Frequently asked questions about Tinea corporis. Is Tinea corporis contagious? Yes. Tinea corporis is highly contagious and can spread through direct contact or by sharing personal items. Can Tinea corporis be cured with home remedies alone? Mild cases of Tinea corporis may respond to home remedies, but it's advisable to seek medical advice for proper diagnosis and treatment. How long does it take for Tinea corporis to clear up with treatment? The duration of treatment can vary depending on the severity of the infection, but it typically takes a few weeks to completely clear up. Can Tinea corporis affect the scalp or nails? Tinea corporis primarily affects the skin, but it can also affect the scalp, Tinea capitis, or nails, Tinea unguium. Can Tinea corporis recur after treatment? Yes. Tinea corporis can recur if the underlying causes or risk factors are not addressed. Following proper hygiene practices and taking preventive measures can reduce the chances of recurrence. Thanks for watching. Take care and stay safe.